Item 1 is a staff briefing and discussion on the Austin Resource Center for the Homeless. Hi. Oh.
To push something? Thank you. I'm Vela Carmen. I'm with Austin Public Health, and I'm going to be giving you an update today on the Austin Resource Center for the Homeless, the one agenda item. Go to the next. So the contract, oh, that's in my power. Excellent. The contract, the new contract began April 1st, 2019, this year. The agency that the contract was awarded to is Front Steps. That was the previous agency operating the shelter. And through the solicitation, the RFQS, or request for qualification statements, that was the top applicant. Front Steps as well. And so the initial term is going to be 18 months, so it will go through September 30th of 2020, and the base contract amount for those 18 months is $4.2 million. This next slide just gives a breakdown per fiscal year. The contract has been awarded as an initial 18-month term with 3 authorized extension options at 12 months each. And so this is a breakdown per each of those time periods. We would amend the contract after the 18 months to exercise an extension option every 12 months thereafter. Something to point out is that one of the changes required was to increase the staff pay rate at the Arch for a minimum of $15 an hour for everyone that is working at the Arch. And that has taken place, and that is figured into this new dollar amount. That's estimated at about $280,000 per 12 months to reach that increased pay rate. The total 54-month contract amount is $12.48 million. So this is a summary of the changes in the redesign of the contract. That left column should say past Arch operations, not part Arch operations. So up until March 31st of 2019, the Arch has had the capacity to sleep 190 people in beds or mats overnight. The Day Resource Center is still currently serving 200 to 300, sometimes up to 400 people a day in the Day Resource Center. Currently, just a portion of the people staying there are receiving case management. And actually, I'm going to sort of talk about the comparison as I go down. So the 190 beds and mats for overnight sleeping is going to be reduced to 130. So that's the redesign. The Day Resource Center that's currently serving hundreds of people will change so that it is only available, those services are available for the shelter guests that are staying there, and that would be 130 at a time. As I mentioned, currently 25 to 30% of the clients are receiving case management, and that will change to 100% of the people that come through the doors and that are staying at the Arch will be in case management. Currently, some of the beds and mats are reserved, and there's a daily lottery system as well. And so people can stand in line to see if there is a place for them to sleep that night. And typically, especially during the winter months, when shelter is especially sought after and more scarce, people are turned away from that lottery process. That won't be the case anymore going forward. There will be reservations for all the people that are staying there, so they will know that they will be staying there each night. And the focus of everyone that is going to be at the Arch is housing focused. And so that will be all the way from the staff that are at the entryway welcoming people working directly with the shelter guests all the way up to leadership at the Arch will be having conversations about housing and how folks can move from homelessness into housing. So currently, because the Day Resource Center opens in the morning for anyone to come in that needs services, all of the overnight stayers must leave early, and then they have to exit the building. There's some time that's needed for cleanup as well, and then they also must return every night at a specified time. And that will be changing so that the people that are staying there, that they know that they're staying there, will have some flexibility to come and go as they please. They won't be required to leave first thing in the morning and required to come back at a set time in order to have access to the shelter. There will still be some restrictions on access, but they'll be much more limited. It'll be much more flexible in terms of people coming and going. Currently, there are services offered for basic needs, and there's some case management and housing services available. And as I mentioned before, all of the services will be focused on housing and meeting people's needs for everyone that's staying there. Be much more focused. Again, currently first come, first serve lottery system, that will be going away. And there will be a strategic prioritization system for the clients. And that's something that has begun that we'll talk about in a little bit later. And then currently the coordinated assessment is not provided at the Arch, or it hasn't been provided. It was originally when our community started that, and then there were changes made so that the coordinated assessment staff were not at front steps, but they are actually currently having some staff trained to do coordinated assessment at the Arch. Austin Public Health has contracted with a consultant, the National Alliance to End Homelessness, and there are several ways that we are interacting with them in terms of getting technical assistance and guidance and their expertise. We had a report from them that was part of the solicitation and informed the new redesign of the Arch. And we have started weekly conference calls, and those are with Front Step staff and Austin Public Health staff and the National Alliance to End Homelessness staff. They're coming on Friday for a full-day workshop on best practices in emergency shelter, and we have a large portion of the downtown shelter staff that will be attending that workshop, as well as staff from all the other shelters in town, and it's also open to interested stakeholders. At the end of May, OrgCode, who is a subcontractor of National Alliance to End Homelessness, and the National Alliance are coming back to town, and they're doing a 3-day intensive shadowing for technical assistance and training for the Front Steps staff. And this is a time where they're going to basically see how Front Steps is currently operating with their staff, and they're going to provide training and assistance and guidance. And so they'll do this visit in May. They will continue to provide remote technical assistance for the next 6 months after that. And then they plan to have a follow-up visit in November to come back and see how the changes have taken place. There's a big emphasis on performance and metrics and looking at data. That work has already begun, and there will be a baseline of data taken at the beginning of those 6 months, and then in November a comparison to look to see where we've gotten. And so we discovered early on, we knew that we couldn't just, you can't just flip a switch and just make changes effective in one day, and that we would need to phase in most of these changes. And so we've looked at these as high-level transition phases over the next several months. Through March and April, there already are some facility improvements. There's certainly been a lot of planning. Part of that planning is a communications plan. We're very aware that we need to be able to communicate to all the stakeholders, and that would be city leadership, that would be clients, that would be other service partners, that would be the hospitals and the criminal justice system, that would be other partners that are co-located there. So we're aware that there's a lot of people that are involved with the operations at the Arch, and that we need to have some clear plans and some clear communication to all the stakeholders. And so we're working on that communications plan. There have been and will continue to be some staffing changes. And as I mentioned, we're developing performance metrics with the help of National Alliance to End Homelessness. So through May and June, coming up here, we'll have the National Alliance to End Homelessness visits. As I mentioned, the performance data baseline. And we've already begun this work, but it will really pick up in the next couple months to identify alternative day resource locations and potential partners and other resources. So currently, people enter the building and get their mail there. They can take showers there. They can do laundry. There's computer access. And so a lot of these resources we understand need to be available in other places if they're not going to be available for anyone just to walk in the doors and access them there. So we're looking at what existing resources are already out there in other locations, how that connects with meal availability, food availability in other locations, and transportation, and then looking at maybe some other partners that we can co-locate some additional services with and be strategic about the current infrastructure around the city and how we might optimize that and what kind of resources that might take. July through September, the reduction of beds and mats will be complete. So actually right now, especially with the weather being fairly pleasant, there aren't 190 people sleeping nightly at the Arch. They have the lottery system still happening, and they are not turning away anybody. So everybody's able to sleep there that has been standing in line for the lottery. But that reduction will be gradual and will be complete by the end of September. By October 1, we anticipate 130, everybody case managed. Essentially kind of the new design of the Arch will be fully operational by then. And the pilot of the new prioritization system. So we began having discussions with National Alliance to End Homelessness and with community partners on how we might prioritize people that would be staying there, the shelter guests. And we've already determined that it will be adult men. There's not another shelter for adult men. The Downtown Salvation Army shelter does have beds for adult men, but that's the largest population that we see that is in need of shelter. And so that won't change. But we're looking at other priorities across the community. The National Alliance to End Homelessness says that communities should use not just the coordinated assessment score for vulnerability, but other factors as well. So we're starting to get input about what that might be and to really use our outreach teams for identifying individuals and getting them connected to services. They're going to continue to give us guidance on how to do the prioritization. And then October through December, as I mentioned before, in November, NAEH and org code will be coming back and reviewing the data and looking at additional changes that need to be made and how we'll continue to move forward. So that is the end. Questions?
Thank you for your presentation. I actually have a few questions, but I'd love to offer my colleagues the opportunity to ask any they have.
Thank you. So thank you very much. I think you said a number of these things already, but I just want to make sure I'm understanding. So, so the changes, the redesign of the changes. So the beds and mats being reserved. When does that start?
So currently there are co-located agencies that have reserved mats there. The host team has some reservations.
I guess what I mean, when does the daily lottery system stop?
We're going to be phasing that out in the next couple months.
Oh, so there's not a set, what do you mean phasing it out?
Part of the phasing for the timing is this prioritization system. So
Okay.
determining how people will
Okay,
to get a reservation.
okay.
And so as we're
So you have
developing
to figure that out first, yeah. Okay, all right, that makes sense. Then, and then the overnight stayers having the flexibility to come and go, all that goes with when you get the changes made in terms of reserving.
Right.
Yeah, okay. Then the last question there is, so on the prioritization, does that allow for couples? When you say adult, is it only adult men? Or
It's
is
only going to be adult men. It will be people identifying as male.
Okay, so is there, and I just don't know this, are there other shelters now for couples?
We're working on that. Some information coming forward about the current shelter capacity. That's not. There's not a lot of that. There are family shelters,
Yeah.
right? So Foundation for the Homeless.
But
and
do you have to have
Salvation Army.
kids to be in a family shelter?
For some, you do. Yeah.
Okay, all right, thank you.
Straight down the line. I guess this is probably not going to surprise you. I'm certain this is everybody's biggest question. What happens to the folks that sleep outside or just hang around outside once you know for certain that those 130 beds are dedicated to specific shelter clients? There's no need for anybody to hang around outside since the lottery system will have gone. So what happens to those people? What's the plan? What are the next steps there? We had the opportunity to take a tour recently, and I couldn't help but notice just how many people are outside.
Yes. And a lot of people outside are not waiting to sleep there. So as I said, currently they have the lottery and they have extra, they have empty beds and mats at night, and people are still choosing not to try the lottery system. We quite frankly don't have enough shelter for the number of people in our community experiencing homelessness.
Right.
And so in terms, if you're asking what happens to the people outside in terms of whether or not they would have a place to sleep.
Not necessarily. I'm asking, if we're going to go through the process of renovating and go through the process of everybody having dedicated counseling and wraparound services, I can't imagine that you want the people who are not staying there to continue to stay outside on the sidewalk, in which case, what happens next? Is that a collaborative effort with other organizations to help those folks find their way? Is it law enforcement? What's next there?
Those are all the questions that we've been asking. If there's not a place for people to stay at night, and we don't have the option, we don't have the option available to offer people, there is not, they're in public property and they have the right to be there, and that's part of the question that we continue to grapple with, is that we don't have enough resources to offer folks. And some folks have been offered resources and declined them, but the majority of folks, I think, would be interested in taking up the offer for services and a place to stay. We just don't have enough. I don't have a great answer to that question. We've been asking that. We've tried several different things, and someone may have a better idea.
Good afternoon, Ms.
Good
Stephanie.
afternoon, Stephanie Hayden, Director, Austin Public Health. So I want to give Bella some kudos for her first presentation. She's did a great job, and she's done a lot of work in the community. There is a group that has been meeting quite frequently, and they have had conversations about not just the internal operations for the Arch, but the external operations for the Arch. And a part of that conversation talks about, increased outreach efforts. We've had conversations about, is there something differently we need to do with the parameter of the Arch, looking at maybe the configuration of the sidewalk. And so basically really trying to engage the people at the Arch. We've done pop-up resource fairs. because ultimately we want to engage everyone that really wants to be engaged and get them connected to some type of services. And so that's ultimately the goal. We'll continue to do that work with the engagement piece, because ultimately we don't want people to be just kind of hanging around the perimeter of the arch. We want to address, where is potentially another safe place that people can be. We've started to have conversations with other partners in the downtown area from a perspective of, is there a place where people will be able to go and have showers? Is there other partners that may be providing breakfast that may be willing to extend their hours of operation to really partner with us, so people will be able to, we can provide that information for people to be able to go to another location. And so all of those things we're going to be working on very closely over the next few months with our partners, and we will get that solidified.
Can we maybe pencil in a tentative date for an update on that?
Absolutely. I know there is a June meeting, but I think it would probably be more appropriate for the September meeting.
Thank you. Another question I had was about leadership. So I guess, I'll pose it to both of you. We talk a lot about diversity, but not necessarily the importance of diversity in leadership. I just wonder if during some of the staff changes that you mentioned, there's going to be any specific emphasis or expectation for there to be more diversity in leadership for Front Steps?
So not just the Front Steps contract, but all of our contracts have a requirement for all agencies to provide culturally appropriate and linguistic services, to really take a look at the composition of their board, as well as the staff that are providing services to them. So that is a requirement in the Front Steps contract, along with other social service agency contracts. So our staff will be monitoring to determine if agencies are adhering to, because they need to develop policies and procedures, and then they need to kind of talk about, how are you going to have a continuous quality improvement? And these are measures that we have adopted from the United States Department of Minority Health.
And along those same lines, I had a question about, we recently had an agenda item that discussed city staff taking undoing racism training. Is that a requirement that we have for these kinds of contracts as well, or is that something that we could consider working into them?
That is something that we can consider working in. We have partnered with One Voice Central Texas, and most of their members are making their way through diversity training as well as undoing racism. So that is something definitely that we can have our agencies to go through.
Great, I think it's very important. I have two last questions. Security. Do you think, given sort of the fewer numbers of shelter clients and the more permanence of their stay, will the security needs shift? And if so, what does that look like? Do those resources just get allocated elsewhere within the organization? Or
I think it's going to be important, as we're moving along in that work that we're going to be doing with Org Code and the National Alliance to End Homelessness. Those are some of the operational questions that we need to discuss with them, because just because we have fewer people may not necessarily mean that we need less security, because since the model is changing and people will be able to access the facility 24/7. So that is a bit of a change to the current way the facility is run. So those are some of the operational things that we'll definitely need to have a conversation with our consultants about.
And this last one may be along those same lines, storage. I just have questions about where people are going to store their things, especially given the expanded sort of access to the shelter. Do they have dressers or lockers or closets or?
So there are lockers at the Arch, as well as
The ones out in the parking garage area?
Yes.
Okay.
Yes. And so since you're not going to have as many people utilizing those lockers, it will allow for a little bit more space for people. So they will be able to utilize those lockers. We've kind of gone back and forth, and Vella may know where we are with this as far as under the beds. We were allowing folks to keep their items under the bed, but we went through a huge consultation as far as looking to really try to minimize bed bugs and keep them out of the shelter. And so as a part of that, the front desk folks were consulted when they consulted with the exterminator. They recommended to move the personal items from beneath the bunks. And so definitely need to revisit that as well, but the lockers are available.
Thank you very much. I appreciate you both.
Thanks very much. I want to add my appreciation. I know this has been a multi-year effort to get to this point, and I know Vella and others have been involved in those, what started as weekly conversations over at the Arch, talking with stakeholders about these changes. And I appreciate, having been in many of those meetings during that pilot summer, I really appreciate the level of work this has taken and really the care with which you're rolling this out to make sure that it is a gradual change, but that we're still hitting that goal of having 100% of individuals case managed. I think that's really important, and it will be a hard change. And so I appreciate again that it's a gradual one, and that we're looking for how to provide those services for the individuals who would be impacted by that change. I have a variety of questions, small and large. So let me start with some of the small ones. Back to the garage, the parking garage space. I know the last time I had an opportunity to tour there, a lot of the lockers, or some of the lockers, were broken. Are they in the process of fixing those so that the clients who are there have an opportunity to use those?
Yeah, we've had discussions about storage. There's a need for just more storage, and this past 2 weeks we've actually had more discussions about storage. So there are additional repairs being happening and planned for the garage, including either repairing those lockers or having an alternative storage option. Yes.
And it seems as if we've heard some feedback from guests that they would like larger, that some of the lockers are a little small for belongings, and so some size variation would be, I assume, is one of the things that you're considering.
Yeah, we're definitely looking at other options. We've looked at other cities, and there's other staff in other departments in the city also looking at different options. So that's a high priority to figure out good storage options. And yes, those lockers are small for the people that would be staying there. Again, the number of people accessing the lockers would be fewer, so that there's potential for more space per person.
And I think, too, we need, and we've talked about it on the dais before, about the need for storage generally for individuals experiencing homelessness, both those staying at the Arch and not. And so to the extent that you need council support for any of those directions, I hope you'll look to us for that, because I think it's a very important need. So with regard to the garage area, we also, I believe there was at some point $500,000 allocated to a redesign of that space, and there have been various conversations that have started and stopped that I know I've been part of, and so I'm trying to figure out where we are with that conversation. If that's part of the next phase to kind of redesign. I mean, the conversations have ranged from maybe opening that up and providing a day space, an outside day space for individuals who may or may not be staying at the Arch, to other kinds of uses. And so where are we with that current conversation, and where are we with that funding?
So
if you need to get back to me, that's fine.
Yeah, the funding wasn't enough for the planned renovation, which I'm sure you're part of those conversations. There are additional repairs that have been happening. The floors are going to be resurfaced, and some additional structural things that need to happen. The building has had quite a bit of wear and tear, as you know if you've been there. And we're looking at potentially the TIF Waller Creek funding might be a source of funding that we could use if we looked at doing some more significant renovation for that garage area. But that is a space that we want to make sure we optimize.
Great. And are those part of is that part of the conversation that you're having with the National Alliance about how to best utilize that space and some of the various options?
I think we will eventually. At this point, when they come to visit, especially org code, they do a lot of shelter-specific work. And so when they come for the site visit later next month, later in May, they'll be able to actually look at it and see. Yes, they will give recommendations for the actual space of the facility.
And hopefully they'll be able to build on some of the work that was done. It seems, if I'm remembering correctly, there was some work done by some UT professors looking at that space. I mean, I think we've had a variety of starts and stops with that exterior space that I hope we can at least look back to and kind of build on. So you've brought me to one of my other points, and that was the one about funding. And as you mentioned, the TERS is an opportunity to maybe provide some funding for physical shelter space. I was not present at the housing meeting, the housing committee, most recent housing committee meeting, but I believe the staff mentioned that that they had identified $8 million for homelessness for shelter. And my staff followed up, and we haven't heard back. But in exploring, it seems like that's coming from CDBG dollars, and so I hope that we can talk about that and really look at how we're using those funds. If I remember correctly, the Waller Creek TIF money, TERS money, is pretty restricted in terms of how we're using it, and I don't know that the CDBG dollars are as restrictive. And so as we look to kind of the range of options, I hope that we're using the flexible funding for operations and maintenance and things that the capital funding can't. But Councilmember Kitchen might have some.
Well, it's certainly a good question to ask. At the committee meeting, they were talking specifically about the immediate shelter with the resolution that we passed in January, and just noting that they had identified some source of funds that could be used for that kind of thing. We didn't ask about any more details than that. So that was the extent of the conversation, and it was part of a conversation where they were talking about the application for federal funds. You know, the plan that they have to do for federal funds, and so they were talking about, this is housing. Rosie Truelove was talking about I'm not going to remember all the details, but that this actually allowed for greater flexibility, the way that they were using those dollars now. It allowed for greater flexibility in their use of CDBG funds. I'm just not recalling exactly what she said.
So I would ask, and maybe we can follow up on this after this meeting. So again, I went back and listened to the tape, and Ashley on my staff did as well, and the best we could tell it was some of it would go to programs, tenant-based rental assistance for individuals experiencing homelessness, as well as some rental support, both of which are desperately needed. But that about $8 million was identified from unused CDBG dollars for the purchase that could be used for the purchase of renovation of a homeless shelter or facility. And so that sounds to me like those would be being put toward capital expenditures. And we have the TERS money, which I think is, we've gotten different recommendations about, but it sounds like that has to be a capital expense. So I hope we can get all of these conversations happening at once. We very recently passed the resolution to look to provide funding for the Salvation Army, which needs ongoing maintenance and operations assistance. And so, again, I just think we need to immediately, and you guys probably are, but we need to really get clear on what funding sources we have. And, Veronica, thank you. So that we're using the flexible funding. If there is a way to step in and help the Salvation Army, which could be a piece of this whole discussion about what we, what services, what housing we're able to offer individuals who may no longer be eligible for the Arch, or we may have fewer, we'll have fewer beds at the Arch, but we may have some beds opening up at the Salvation Army if the families at the Salvation Army are able to move to the Tannehill location. And so, again, I'm sure that you all are working together to figure that out, but I would love an update.
Yeah, so basically we're talking about a number of things. We're talking about the immediate shelter that we passed the resolution for in January. We're talking about the funding for Salvation Army. And there's lots of other needs, but there may be others, but those two specific things are both on the table to be funded. So I can't remember if we have a resolution out on something else too, but those two specifically.
There's a lot of resolutions out, but those two I think are
those
the ones.
Those two specifically.
Yeah, those two relate, I think, directly to the conversation we're having today about what happens in July and August as that bed capacity reduces.
Veronica Briceño, interim homeless strategy officer. We are very much having those discussions, and we certainly understand that there is available funding that have different restrictions on them, and we're trying to make sure that we're cognizant of that. My understanding, and I believe Ms. Truelove is working on a response to your office of the details of the funding that was identified, but it is about $8.5 million that was identified in CDBG funding, and it does have some restrictions as well in terms of being for brick and mortar, for capital improvements, as opposed to operations and management. So we are taking all of that into account, including the funding of the Salvation Army, the resolution that was passed, as well as we're trying to propose a strategy or an approach to how we can work towards solving this issue or having some resolution to the issue.
Thank you for that information. Let's see, I had a follow-up question that just went out of my head. Hopefully it'll come back to me.
Did you have any other questions? Well, the beauty of it is we know how to get in touch with her.
I did want to follow up with one other point in terms of the numbers of people. With this new focused redesign model of everyone that is staying there, having housing-focused case management, we anticipate people not staying there as long as they have been. And so we anticipate, even though there are only so many beds or mats, that the turnover rate will be faster, and we will be able to get more folks into the shelter, into services, and into housing. So that's the plan, and the National Alliance to End Homelessness is very confident we can get there. So
Awesome, thank you.
I remembered my question.
You remembered it?
I did. Thank you. But I want to thank you for emphasizing that because we're talking about the reduction of beds. Thank you for reminding us of that larger purpose, which is to get people from the shelter into permanent housing, and the fact that the outside consultants who have provided information and the stakeholders themselves have indicated that this is the way to do it, by really providing that focused caseworker assistance to those individuals to help move them out of the shelter into permanent housing. My question was with regard to the Affordable Housing Trust Fund and whether that is also being analyzed for whether, because that's a relatively flexible source of funds, are you also looking at whether we're funding any bricks and mortar work through that could be shifted to the TERS or the CDBG funds?
We haven't had that specific discussion just yet, but I think overall our approach, and I've been working very closely with both health and housing, has been looking for any funds available, and specifically looking for funds that have some flexibility to fund some of the programs that we want to, or some of the things that we want to do. So that particular one hasn't come up. I'm sure Rosie's group is probably looking at that. I haven't had that conversation with them, and it's certainly worth visiting.
Great. And I know the last time, I can't remember now whether it was the Downtown Density Bonus funding or the Affordable Housing Trust Fund, but there was a need for council action to make it slightly more flexible. And so, I would just offer that if there's a need to make the Affordable Housing Trust Fund, if there's a policy change that's necessary to provide the kind of flexibility we need, I hope you will suggest that to us. The last time I looked at it, it seemed to me it's really quite flexible and could accommodate a variety of needs for services or programs for individuals experiencing homelessness. But to the extent that policy changes are necessary, please let us know.
Absolutely.
So thank you for that work. I know it's complicated and it all has to be done very quickly. So thank you for your continued work on it.
And if there are no further questions, that was actually the only item on our agenda today. If anyone in attendance needs their parking validated, please see the clerk there at the front of the room with her hand raised. And if there is no objection, we are adjourned at 2:45.
I'm on my way.